I'm Sue Dyson, and I'm going to be focusing on forelimb lameness detection and the grading and characterization of forelimb lameness. I am passionate about the grading and characterization of both forelimb and hindlimb lameness. And one of the most common problems that I see with inexperienced lameness clinicians is their failure to recognize the degree of lameness, and therefore often failure to recognize when there has been improvement in the lameness following diagnostic anesthesia. So why should lameness be graded and characterized? I think it's important so that we can compare the lameness severity seen under a variety of different circumstances. For example, in hand, on the lunge on a soft surface, on the lunge on a firm surface, and perhaps ridden. I think it's important for accurate record keeping. I also think it's important for accurate communication between the veterinary surgeon and the client and among veterinarians. It obviously provides us with a way of documenting the response to diagnostic anesthesia, and also is a way of assessing any response to treatment. I think grading is not sufficient because there are many different ways in which horses adapt to lameness, and I want to be able to describe all the gait variants that I see. So, for example, the horse on the right, which actually is in canter, we can observe that there is a head tilt with the nose to the right. This was worse in canter than in trot, and worse on the left rein compared with the right rein. However, the horse also demonstrated a left forelimb lameness, which was only apparent on the right rein and only when ridden, which was a grade 2 out of 8. Looking and seeing, remembering patterns, thinking, describing and learning are all, I think, key features of becoming a successful lameness diagnostician. Sophocles said, "Look and you will find it. What is unsought will go undetected." Thoreau said, "The question is not what you look at, but what you see." Zent Georgi said, "Discovery consists of looking at the same thing as everyone else and thinking something different." And I think all of these are very true and are very applicable to lameness evaluation. So in this horse walking on the left, we can see that it's plaiting in front, it's landing on the palmar lateral aspect of the left front foot, and its tongue is out. Why is it doing those things? I think we need to be looking at the horse and learning to read the horse. I believe that identification of lameness is an art and a skill that with practice and guidance can be enhanced. It is much more than assessing head nod and hip hike. And I do believe it's valuable to assess the whole horse under a variety of circumstances. And to be somewhat controversial, I believe that a suitably trained human eye and mind are potentially better than a variety of objective means for assessment of multilimb lameness. A commonly used lameness grading scale is that of the American Association of Equine Practitioners. And contrary to common usage, this is not an ordinal scale. Each grade has specific definitions. So grade 1 is difficult to observe and not consistently apparent regardless of the circumstances, such as weight carrying, circling, inclines, and hard surfaces. Grade 2 is defined as difficult to observe at a walk or trotting in a straight line, but is consistently apparent under certain circumstances, such as weight carrying, circling, inclines, hard surfaces. But what about the episodic lameness, the intermittent lameness? Grade 3, the definition is consistently observable at a trot under all circumstances. Grade 4, obvious lameness with marked head nodding, hitching, the hindquarters, or shortened stride.